Okay, everyone getting food, getting full, enjoying the lab. I always found it weird to like eat meat after you're doing a cadaveric lab. It's always a little bit strange. Okay, so I'm going to do a quick 5-minute review on the communications committee and kind of social media of CSRS. Dr. Bobby Tay and I are co-chair of the communications committee. No relevant disclosures. So historically, the CSRS recorded all of the meetings, annual meetings, ICLs, things like that. And when John Rhee was president, one of his big things was to make this a repository so that people could access it. And it used to live, and still does live, on the CSRS website. A few years ago, we said, why don't we take that concept of making these things live on for a long time so people can learn from them, more to a more accessible way of looking at it, which would be on YouTube. So right now, we have all these new videos added to the CSRS archive, just keep the spirit that John had of having everything together so that they can be reviewed. So if you haven't been to the CSRS YouTube channel, please go and subscribe. Basically just search Cervical Spine Research Society. These are posted. Titles are there, obviously some clickbait. Right now we are up to over 130 videos, and we add 10 a week. These are the legacy videos plus the new videos. We have about 1,200 subscribers now, and about 56,000 views and 3,400 hours of watch time, which is nice to see. You can see it slowly growing over time. Some of the popular videos, some have 7,000 to 10,000 views. It's interesting, I think a lot of surgeons watch this. I think a lot of patients watch this as well. You can see what patients are searching for, what surgeons are searching for. There's Alpesh. Nice. I like that. There's John Rhee. I like that. Okay, so if you're gonna use it, it's really hard because there's 130 videos. It's hard to like scroll through everything and see what it is. So just a couple of points. The first is using the playlist function. So if you hit the playlist function, then everything gets bucketed. So you'll see like the CSRS Emerging Leaders course, annual meeting 2020, annual meeting 2022, ICLs 2022. Just an easier way of categorizing it. So I wouldn't go there and just try to watch random videos. The other thing you can do is you can use a search button. So if you click search, we've hashtagged things. So if you're looking for myelopathy or C5 palsy, all the videos related to C5 palsy come up. So that's a really nice way of searching in the midst of what will eventually become thousands of videos for what you guys want to see. The webinars are all recorded. There was a recent one on occipital cervical fixation. We take the entire webinar and chop it up. So for example, there's like part 1, part 2, part 3, occipital cervical fixation, freehand, Wright did that one. And they're all organized, so they're pretty simple to look at. The next one is the cadaveric technique videos, which I think will probably be the most useful for you guys. So last year we decided to record high quality videos. Some of the past presidents of CSRs participated. We did them in this lab. They were, sometimes 20, 30 hours of content that gets chopped down, edited, figures added, PowerPoints added. So you guys can use them as a resource for kind of a step-by-step cadaveric technique. So last year, Mike Dobbs did laminoplasty, Alpesh did lateral mass screw fixation, Rick Sasso did C1, C2 fusion, including interlaminar, C2 translam, pars, parsicle screws, all that. John Rhee did ACDF, exposed vertebral artery. This year, you just filmed the odontoid screw one, and you just filmed the posterior framenotomy one. Next year, we will thinking of doing a cervical disc one. So techniques on MoBC, on all the two-level ones, Prestige, et cetera. This is just an example. This is really spliced short.
So we've got an exposure.
This is Alpesh's video, but it looks something like this.
C3, C4, C5, C6, and C7. There's a technique that's called a funnel technique where you gradually burr all this away looking for cancellous bone. And the angle you typically want is a pretty steep angle. It's about 45 degrees. Feeling bone, hopefully all the way. So obviously with pedicle screw fixation, you get longer screws, you get cortical.
This is a 20-minute video. You guys get the idea.
Fixation, but it comes at a cost, which is the risks associated with placement. Okay, there you go. C6, C7 pedicles.
So that's just like a little preview, but that's what they in general look like. There's a search function I talked about, which is an easy way to search for specific topics. Other things we have, we're on X, Facebook, Instagram, LinkedIn, and you'll probably see CSRS LinkedIn posts. So now what we're trying to do is twice a month, we are having some of the members post cases, having people comment, linking to the learning video, and you guys feel free to join the banter on LinkedIn. Also, same on X, same on Instagram. And things we have ongoing, again, we're going to do more cadaveric techniques. We're going to continue to highlight videos from past meetings. The clinical spine surgery journal has different highlight topics. This upcoming one is cervical trauma. So what we'll do is we'll have each author do a quick, like 3-minute what's important in their review article and just a really quick review. So instead of reading the whole journal, if you want, you can listen to a 10-minute, 20-minute video and get the key points of the journal. We're going to try to collaborate with CSRS Asia and Europe. We're trying to get Dong-Ho Lee. He's agreed to do a anterior vertebral body sliding osteotomy video, which is rarely done here, but commonly done in Asia. So he's going to film an intra-op. We will try to do overlays and try to do a surgical techniques video intraoperatively for VBSO. And obviously, we'd like to get residents and fellows engaged, watching the channel, contributing on LinkedIn on the cases, et cetera. So as you guys become attendings and join CSRS, you can help as well.